Hi friends, apura ki khabar, kaisi ho? I'm your host Shumaya Weinstein. I'm a peer educator, passionate about food and fitness, and a champion for reproductive health. For my second episode, I'd like to create a dialogue with Doctor Catherine DeUgarte about my pregnancy, then the miscarriage, and performing the DNC and understanding genetics, with the hopes to create awareness of fertility's ever-ticking clock that stops for none. So make sure to subscribe, like, and don't forget to click on the icon button below for every time I post a new video. You heard that?
Yay!
With my show Lifesavers and this episode, I hope to create awareness about fertility in our Desi culture, whether you're Bengali, Pakistani, or Indian, as well as other communities as well. There's a lack of discussion surrounding the topic of fertility and how it affects both men and women, particularly women over 35 years old. Coming from Bangladesh as a little girl and growing up with the Western culture, some of the challenges that I faced was not being able to speak about the birds and the bees with my family, particularly with my Ammu. She thought it was natural for us to not have a discussion on reproductive health. It's not something she spoke about with her mother, and it seemed like history was repeating itself with my sister and myself. With the help of health professions, I hope to break this pattern and introduce you to various doctors. Today, we will be speaking with Doctor Catherine DeUgarte from CMD Fertility. Hi, Dr. Catherine DeUgarte. Thank you for your time and enlightening us about the topic of fertility. Can you please introduce yourself?
Hi, my name is Dr. Catherine DeUgarte. I'm a reproductive endocrinologist and infertility specialist, and I work at CMD Fertility in Los Angeles, and I have been an infertility doctor for about 16 years now in practice.
Can you tell us a little bit about your education, background as an OBGYN, and now as a fertility specialist?
Sure. So I did my medical school in college in Boston at Boston University. I did something called the 7-year medical program, where you go from high school to through medical school, and it takes 7 years instead of 8. So you have to go to school in the summer, unfortunately. And then after that, I did my training at UCLA, 4 years in OBGYN residency, after which I did 3 years of infertility specialty at UCLA and Cedars. And after that, I went to Henry Ford Hospital in Michigan for 2 years, where my husband did his training for pediatric surgery. And then, since 2007, I've been back in Los Angeles practicing infertility.
Will you please help us to understand the female reproductive system, the difference between follicles and eggs?
Sure. So women are born with about 1 million eggs. In terms of the follicles is basically the house of the egg. And so when we look with an ultrasound, we can't visualize the actual eggs, but the eggs are in the follicles. And usually the follicles that you see are the ones that are actively recruiting eggs. And so usually there's about 1 egg per follicle that you're seeing on ultrasound, but sometimes there's less. Sometimes the follicles are empty.
Can you please tell us the importance of egg quality?
Absolutely. So as women age, the egg quality goes down, unfortunately, and it does so much more dramatically than in men. And so every year, as we age as women, after we're teenagers, the quality of the eggs goes lower and lower. And so when we're teenagers, the best eggs are released, which is why teenage pregnancy is higher, because the eggs are better quality. And after 40, it's tough to find normal eggs sometimes, because there's less normal eggs available since they've been sitting in our ovaries for 40 years.
As women get older, what age should they be concerned about egg quality and quantity?
There's a decline in fertility, and some people say that it's after 35. Other studies show that after 37 there's more of a sharp decline in egg quality. What I see in my practice is that definitely after 35 it's more challenging to get pregnant, and for sure after 43 it's very difficult to find the normal eggs. I have had patients as young as 25 come to me for fertility treatment and egg freezing, and as old as 53, 54, who have come for most of those patients using an egg donor. But that's the range. But most of my patients, I would say about 75% of my patients are over the age of 40, and about 25% of my patients are 35 to 40.
What are your thoughts on my pregnancy and the miscarriage?
So in terms of getting pregnant the first time, I think what happened was, and it looked like a beautiful embryo, was unfortunately abnormal, and that is the embryo that took and resulted unfortunately in a miscarriage.
During the DNC, why was genetic testing on the embryo so important? And please help us to understand genetic testing.
So a lot of doctors don't do genetic testing when they do a DNC for patients who undergo miscarriages. I believe it's very important to know if the embryo is abnormal or not, even if after one miscarriage, because it gives you a lot of information. For example, if the embryo is abnormal, then in a way you feel better that it didn't continue to term, in which it would have resulted in an abnormal baby. So it gives you information about that. It can also tell you if the abnormality came from the female or the male. Sometimes you can tell that from the genetic testing. It can tell you that. In terms of the genetic testing, that it comes back normal, sometimes that's important to know, because if the genetic testing is normal, that means there's something else going on, like a blood clotting disorder or something called thrombophilia, or some other issue with the uterus that caused a miscarriage to happen. So again, either way, it's important to have that information so you can decide what to do on the next step.
Can you please tell us the process of in vitro fertilization, also known as IVF?
Sure. So in terms of the process, usually it involves 10 days of fertility medications in the form of shots. So patients have to either administer themselves, or the partner gives them the shots, or our office can administer the shots. And these are subcutaneous shots, so they're done in the belly button. And there's usually 2 or 3 shots a day that people take for about 10 days. And then ultrasounds happen every about 3 to 4 days, as long as blood tests, to figure out, do we up the dose or lower the dose of medication? Do we add another medication to hold the follicles from ovulating? And then we wait till the follicle gets to a certain size, usually around 18 millimeters for the follicles, and then we do something called the trigger shot, where we give the patients a special trigger shot which makes the follicles, the eggs ovulate into the follicular fluid, so that 36 hours later, after the trigger shot, we put the patient to sleep, and we do a procedure called an egg retrieval, where we do an ultrasound and then an egg harvest of the eggs from the ovaries under direct visualization, and then we empty the follicles, and hopefully each follicle has an egg, and then we can get them together with the sperm, either by putting sperm around the eggs if there's a lot of eggs and if the sperm looks good, or by a process called intracytoplasmic sperm injection, where it's called ICSI, where we put the sperm directly into the egg, and that's in cases where there's not a lot of eggs or there's few sperm. So after the sperm and the eggs get together in the dish, the next morning, the embryologists check the embryos to see if there's evidence of fertilization. So they look under the microscope to see if there's something called the 2PN nucleus. So that means there's 2 pronuclei, one from the mom and one from the dad, and that's evidence that the egg fertilized. And after that, they put the embryos in special culture media, and they grow them till usually day 5 when they become blastocysts. And when they're blastocysts, they can either be frozen for future use, or they can be biopsied, and then they undergo genetic testing to see if they're normal or abnormal, and they're labeled, as 1, 2, or 3, and they're placed in different straws, little thin tubes where they basically get frozen, and they're labeled 1, 2, 3, so that you know which ones are normal and which ones are abnormal when you get the genetic results back. The next step is that the next month you do something called a frozen embryo transfer, where you can actually transfer the embryos after taking estrogen and progesterone It's about 3 weeks of estrogen and about 6 days of progesterone before you do the transfer, and that's something called the frozen embryo transfer. So most doctors, I would say probably about 90% of transfers nowadays are frozen embryo transfers, because the studies have shown that they increase pregnancy rate and patients have less chance of something called hyperstimulation syndrome from all the hormones.
When should a couple consider IVF?
So in terms of when is the best time to do IVF, it depends on the couple and the situation. And obviously a workup is very important. So patients who should go straight to IVF are patients who don't have good fallopian tubes, so they're blocked fallopian tubes, patients whose husbands have very low sperm counts, or patients who have decreased ovarian reserve, where they don't have a lot of time to try other methods, such as insemination. So IVF is not something that everybody should do right away. I think a lot of times my patients get pregnant by other methods, and I think it has to be individualized. And I think a full workup is important to figure out what pathway is best for each couple, because it's not a cookie cutter approach. I think everybody should do whatever's right for that patient. For example, if it's a 39-year-old patient who has 5 follicles and she wants 2 babies, it might be a good idea to go to IVF sooner, so that she has the possibility of having that second baby in the future. And because if she has insemination or gets pregnant the natural way, by the time she's ready for baby number 2, there may not be a whole lot of eggs left over.
For someone like myself and many other women struggling with fertility issues, what would you recommend?
So I recommend for sure to not give up your dream. I think it's important that sometimes, unfortunately, it doesn't happen on the first try. I just had a patient who delivered a baby recently after having done 3 retrievals and 6 transfers over the course of 3 years. And the baby's finally here after that long journey, and she's so happy she didn't give up. So sometimes it does take, unfortunately, a few cycles to get there. But the good news is that everybody somehow eventually gets to baby and to be a mom and a dad. So that's what keeps me going every day, is that I know that everybody eventually gets there, and I get my baby pictures in the end. And sometimes it takes a month, and sometimes it takes 5 years to get there. So I would say that I'm lucky that most of my patients get pregnant on the first cycle of IVF, especially if they do genetic testing. For example, this past month, 12 transfers, and 1 we're actually figuring out today if she's pregnant. But out of the 11 that we did, 9 got pregnant, and most of those were on the first try. Obviously, we don't know if they're going to have miscarriage or not, hopefully not, but they did get pregnant in terms of the transfers that I did this month.
For more information, contact CMD Fertility at 310-873-1800. I hope this episode was both informative as well as educational with Doctor Catherine DeUgarte. Stay tuned for more episodes of Lifesavers, and I'm your host, Shumaya Weinstein. And if you have any questions for our doctor, please feel free to reach out to me either on Facebook or Instagram at Shumaya Bang.